Hello people, welcome back to the channel. So this is the part 2 of the short note on thyroid gland, and in this we'll be covering the arterial supply, venous supply, nervous supply and the applied anatomy of the thyroid gland. Let's start. Coming on to the arterial supply of the thyroid gland, it is mainly supplied by the superior and inferior thyroid arteries. The superior thyroid artery is a branch of external carotid artery. It runs downwards and forwards along the external laryngeal nerve as shown here, and it reaches the upper pole of the lobes and divides to anterior and posterior branches. Posterior branch descends along posterior border and anastomoses with the ascending branch of the inferior thyroid artery. Anterior branch descends along anterior border and continues along upper border of isthmus to anastomose with its fellow of opposite side. Coming on to the inferior thyroid artery, it is a branch of the thyrocervical trunk which runs along the medial border of the scalenus anterior muscle and passes medially behind the carotid sheath to reach back of the gland. It divides into 4 to 5 glandular branches and reach the lower part of the gland. So there is an artery which arises from the brachiocephalic trunk or directly from the arch of aorta, which is known as the thyroidea ima artery, which enters into the lower part of the isthmus, and it is present only in 3% of the individuals. Coming on to the venous drainage of the thyroid gland is drained by the superior thyroid veins, the middle thyroid veins, and the inferior thyroid veins. The superior thyroid vein usually emerges at upper pole and passes along with the superior thyroid artery and drains into the internal jugular vein. And the middle thyroid vein emerges at middle of the lobe, and similarly it also drains to the internal jugular vein. Then the inferior thyroid vein, it emerges at lower border of the isthmus and in front of the trachea. They form a plexus and drain to the left brachiocephalic vein. Coming on to the lymphatic drainage of the thyroid gland, its lymphatic drainage is divided into two parts, the upper part and the lower part. Upper part के अंदर the prelaryngeal nodes passes the lymph to the upper deep cervical lymph nodes. Then in the lower part we have two nodes, the paratracheal and the pretracheal. They drain the lymph into the lower deep cervical lymph node. They drain their lymph into lower deep cervical lymph node, and ultimately the upper deep cervical lymph nodes also drain the lymphatic drainage into the lower deep cervical lymph nodes. Fine. Now coming on to the applied anatomy, हाइपरथायरॉयडिज्म के केस के अंदर जो थायराइड ग्लैंड है वो ट्रू कैप्सूल के साथ रिमूव किया जाता है और इस रिमूवल को थायरॉयडेक्टमी बोलते हैं. अब जैसे कि हमने पहले पढ़ा था कि ट्रू कैप्सूल के नीचे एक डेंस वीनस प्लेक्सस प्रेजेंट होता है. सो थायरॉयडेक्टमी के अंदर ग्लैंड जब रिमूव किया जाता है तो ट्रू कैप्सूल के साथ किया जाता है ताकि हैमरेज ना हो. हैमरेज मतलब ब्लीडिंग, तो ब्लीडिंग ना हो. Coming on to the second case is of simple goiter. So simple goiter is the enlargement of gland without any signs of hyperthyroidism, and this occurs due to the deficiency of iodine in diet. Lastly, the tumors. Tumors of the gland can spread to neighboring structures and may cause compression of structures like trachea and nerves. Thank you so much for watching, guys. Please like, share and subscribe to my channel, and if you want the notes you can always comment down in the comment section below and I'll provide them in the Telegram channel. Thank you so much. Bye.